Welcome to the Bringing Cooking into Education and the Community session. My name is Sarah Bentley. I'm the founder of Made in Hackney, and I'm joined today by GP Hayley Tait online. She'll be joining us by Zoom because sadly she's not feeling too well today, but she is still able to do her talk, which is great. Sharon Gardner, community class cookery teacher and naturopath from Made in Hackney, and Marisa Heath, the CEO of the Plant-Based Food Alliance. Now, you've got really solid bios of everyone speaking today in your programs, so I love how the desk just goes up and down as you speak. It's just like, what's happening? So we won't do introductions because you can get any information you know that you want to know about us from your program. We're going to get straight into the talks. By now, you should all be clear with how Slido is working. Are we feeling confident with Slido now? It's much easier than I thought it was going to be, actually. I was very nervous about Slido. But please put all your questions on Slido and we will ask them at the end of the session. Okay, fantastic. So I'm going to kick off today. I'm Sarah Bentley, and as I said before, I'm the founder of the UK's first vegan community cookery school and charity Made in Hackney. I'd like to talk to you today about joy and community and how I've seen what a vital role they can play in the transition to a fairer, healthier and happier world where plant-based eating is the norm and not the exception. When I started Made in Hackney in 2012, veganism was viewed with great suspicion. Vegan food was seen as bland, unhealthy, extreme, and vegans were angry, preachy, and definitely no fun. But I knew with just a little gentle exposure, people could soon change their minds. So I've been vegan since I was 20, and from the age of 22, I held regular parties in my back garden called Skank and Grills. We'd put up a sound system, fire up the all-veg barbecue, and lay out a massive buffet. There was sprouted mung beans, creamy dill potatoes, jerk fried tofu, tahini coleslaw, loads of Ottolenghi-style salads before he was a thing. It was going on. It was pretty good. Now, of the 60 or so people that passed through those events, none of them, except for a couple of Rastafarian friends, were vegan. And yet, to a background of music, dancing, and laughter, this food was always devoured. People would ask me what this and that was, where to buy it, how to cook it. Recipes were shared, and kids with dairy allergies grew up wanting Auntie B's special no-cow coleslaw. Now, without a doubt, these parties changed how my friends and family ate, and it was done with tasty food, community, and joy. So when I started Made in Hackney, I knew that this same sense of community and joy was vital if people actually wanted to attend a vegan cooking class, but also if they were going to successfully make long-term diet changes, they needed to hold a positive feeling in their hearts, minds, and stomachs about the food they were aiming to transition to. It couldn't be perceived as diet food. It couldn't be perceived as hardship food or something your doctor told you had to do and it was going to make you miserable. It couldn't be like that. There could be no lectures, there could be no fear-mongering, and there could be no judgment for where you were currently at now. But there had to be care, collaboration, and good times. So in our first 2 years of delivering cookery classes in community venues across London, we unsurprisingly did have some pushback. There was a dietitian who accompanied a youth group, and after they'd cooked and eaten chili non carne, greens, brown rice, and berry smoothies, as they were leaving the class, she handed out ham sandwiches and crisps because she was very concerned about the nutritional profile of the food they'd just eaten. Real story. There was also the diabetes team at a nearby hospital who refused to refer their patients to our classes as the food was chronically unsuitable. There was also the children's centre manager who described our food as irresponsible and extreme. Now, these responses, they were actually the exception and not the rule, and most people praised us for the quality and taste and variety of our food. They had a great time, and they didn't even realise what they were cooking was vegan till the third or the fourth session out of 6, and that was intentional. We went really easy on the word vegan back in 2014, we're talking now. So some of our early triumphs, just to share a few stories. There was a Zimbabwean woman who attended 2 of our 6-week courses, and within 6 months, her type 2 diabetes was in complete remission. We had an elderly man who used to always come to class wearing an apron with an arrow pointing down saying, "Big sausage." And he told us at the age of 82, he had cooked his first meal in his entire life with us. And finally, we had a lady in her 50s who found our food very challenging in the first few weeks. There was a lot of going on, never a good sign. But by the end of the course, she told us her blood pressure had lowered, her taste buds had changed, and she enjoyed all sorts of healthy food she couldn't stomach before, and she was planning to do a Made in Hackney on her husband's diet. Pretty cool. So I'm not a dietitian, a nutritionist, or a chef. I'm probably one of the few speakers at this conference without any health-related qualification. I'm a former reggae dancehall music journalist, I know, surprising, a community gardener, and the daughter of a home economics teacher. So to see this recipe of good food, community, and joy changing lives like that, it actually felt like real magic. So since those early days, we've delivered thousands of cooking sessions across London, the UK, and now the world, thanks to our online programme. We've cooked in hostels, women's refuges, schools, nurseries, pensioners' lunch clubs. That doesn't always go so well, actually. SEND schools, city farms, community centres, corporate boardrooms, council offices, and many, many other locations. We've hosted community feasts with dominoes, poetry, and dancing. We've held kids' kitchens where little ones craft beautiful animal faces out of chocolate hummus and fruit. We've had vegan cheese parties and massive summer bashers with Ghanaian acrobats and steel pan bands. We've been joined by a hugely diverse team of chefs who bring their unique food ways and culture to the Made in Hackney table, which is so critical if we're all going to transition to a plant-based diet and ensure no one is left behind. Finally, and most recently, we've held an online plant-based kitchen international get-together for learning, co-collaboration and support. And as part of our Global Plant Kitchens training programme, we have an online course available for how to do a Made in Hackney in your area. And we're currently mentoring a team in Macau, in Peru, in Belgium, the US, and we're looking for 5 more collectives to mentor. So if this looks like a bit of fun to you and you fancy setting up a Made in wherever, then let us know, because you could maybe be one of our mentees. When the COVID-19 pandemic struck, we can all probably remember that community and joy was taken from us very abruptly. At Made in Hackney, we pivoted our services rapidly to provide free, nourishing plant-based meals for households in need. But we could see that the conversation, the smile, and the interaction with the food delivery courier was as important for sustaining people as the actual meal itself. Since launching that service, we've provided over 200,000 free, culturally diverse plant-based meals, a feat that we're simultaneously proud of and really appalled about, because in the 5th richest city in the world, why do so many people need food support? So although we know the impact of our work is deep and far-reaching, as we've grown and become bigger, it has actually become increasingly hard to fund. Our kitchen is a safe and inclusive space for everyone, not just one type of person. We're never going to means test people to see if they qualify to do our course or if they qualify for free food support. This can make it very hard to convince people to give you money. But if you start doing that, would you be a safe and inclusive space? I don't really think so. We're never going to weigh people, take their blood pressure, and ask people to measure their insulin levels in front of us one week to the next. It just wouldn't be appropriate. Everyone arrives at Made in Hackney with their own story and leaves with their own very unique, hard to measure outcomes. So recently, Joan has learnt to bake a vegan cake for her recently turned vegan granddaughter's birthday. Fred learnt that rabbit food was actually quite tasty. Basodi lowered her diabetic insulin levels. Lynn lost weight and made new friends. Margaret had a much-needed break from looking after her 3 adult autistic sons while learning to cook West African plant-based food. 12-year-old Maisie cured her chronic bowel complaint, returned to school after being absent for a year, and started ice skating in her spare time. Claire began healing an eating disorder by cooking and eating in a caring, communal setting. And Steve got out the house, learnt to save money on his food bills. Everyone had a good time, and everyone ate more plants because of it. So could such a myriad of outcomes have been achieved any other way than with a vegan community cookery school? Possibly, but probably not. I'd like to leave you with a thought from one of our spectacular volunteers, Juliana. She's a Caribbean elder and an absolute font of food growing and cooking information. There's not really anything she doesn't know. And she talks to us about why community cookery schools like Made in Hackney are so important. She says, life can be hard, people are struggling and suffering, but when I come to Made in Hackney, I feel like I'm in a different world, a world where we care about each other and the food is always good. It lifts me up. I think it lifts us all up. Thank you. So next we're going to have Hayley joining us by the power of Zoom. So introducing Hayley.
Thanks so much, Sarah. It's just wonderful to hear all the fantastic success stories you've had and the way you're reaching out to everybody. So good afternoon, everyone. Thanks for coming to hear about plant-based nutrition in clinical practice. I hope you can all hear me okay? Is it working? Yeah. So I'm Hayley Tait. I'm an NHS GP based in Liverpool, and I promote a whole food plant-based diet as part of lifestyle medicine for the health of all. I practice what I preach with a daily meditative practice, nurturing positive relationships. I exercise with yoga, running, gym or swim, and I'll regularly take a cold water dip in our Mersey estuary. I prep and cook whole food plant-based food and avoid toxins and enjoy the benefits this brings. But currently I'm infused with lemon, ginger, garlic and turmeric to battle this flu-like illness. So what we'll cover today, many of you are here to learn about plant-based nutrition in clinical practice as you recognize this unmet need in our training or practice, along with all the aspects of lifestyle medicine and a global approach to our healthcare crisis. So today, I hope you'll be inspired to share the message with friends, family, patients, and colleagues to make a difference in our public health and health equity. The current problem is healthcare professionals are firefighting. Poor nutrition and lifestyle underpins most of our chronic disease, yet our future healthcare workers are varied and in most cases inadequate training in nutrition at undergraduate level. Healthcare professionals are band-aiding in an underfunded, under-resourced NHS, treating a disempowered public. And we need to empower patients to make health-promoting dietary change. When we learned about pathology in med school, we learned the causes, including lifestyle factors, smoking, alcohol, a poor diet of Coke and chips. But our solutions were pharmaceuticals and surgical approaches, and very little in current medical training has changed. Meanwhile, the NHS is crumbling under the weight of this chronic disease burden. Politicians are short-sighted, so it's up to us to demand a better system. And teaching the principles of plant-based nutrition for the health of all, using lifestyle medicine as first-line approach wherever appropriate, training on new healthcare professionals at undergraduate level, upskilling current professionals, demanding better from government to fund this innovation, whilst tackling the social injustice that defines poorer health outcomes in deprived areas. It's lazy medicine from both patient and doctor to line up for the latest treatment without first adopting healthy lifestyle habits. And I'm sure you've heard a lot of these today. My personal experience in nutrition education was a recap of A-level biology, including the physiology of digestion, looking at dietary components in terms of macronutrients, vitamins, trace elements, and little else. Only when I felt so much better in myself after adopting a plant-based diet age 46 and vegan did I go on to explore the overwhelming evidence for plant-based diet in the treatment and prevention of disease. But I'd been a doctor for 22 years before I enhanced my practice with these skills and began to educate public, patients, and other healthcare professionals. I can't think of a GP consultation where asking about nutrition and diet isn't important. So what's been happening in the undergraduate curriculum? Well, in 2018, the Association for Nutrition took over the planning and implemented its current form in October 2021. But despite there being GMC outcomes for graduates, there are no set quantities or qualities for medical schools to adhere to, meaning that only pockets of innovative nutrition training or integrating nutrition into a holistic model of care in the curriculum. In 2019, the Lancet Planet Health published data concluding, despite the centrality of nutrition to healthy lifestyle, medical students are not supported to provide high-quality, effective nutrition care. And in 2022, Dr. Shireen Kassam and Priya Patel published in the Journal of Human Nutrition and Dietetics, Evaluating Nutritional Education in Medical Schools. Their conclusion included that institutions may also consider a curricular-wide approach to integrating nutritional education using national guidance to improve standardization of learning objectives and assessment. And this review highlights the advantages of utilizing interprofessional learning, focusing on students' personal health behaviors, and harnessing novel teaching methods such as hands-on cooking. In 2022, the BMJ Nutrition Prevention and Health published an article highlighting the inadequacy in nutritional education and suggested ways to improve, including its incorporation in the core curriculum. And in August this year, an article from the Frontline Gastroenterology Journal highlighted the inadequacy in nutritional education and suggested ways to improve, including incorporation in the core curriculum. So it's clear there is inadequate nutritional education. And remember that 20% of all global deaths relate to suboptimal diet. Improved knowledge will aid our chronic disease prevention and treatment, specifically type 2 diabetes, cancer, cardiovascular disease. Healthcare professionals need the knowledge and skills to be able to promote delicious, affordable, healthy, and culturally appropriate food to our patients for their wellness. We can deliver this information in a variety of ways, including a full multidisciplinary team of chefs, nutritionists, and healthcare professionals. The Cooking for the Climate course uses an interactive and hands-on approach that's been very effective and popular. A major barrier has been apportioning time in an already full curriculum, but this is the most relevant and important learning to have a positive impact on reducing chronic disease burden. There's some concern that medical school education is led by secondary care doctors who don't prioritise nutrition and training, nor recognise the extraordinary prevalence of diet-related disease. I'll cover specific barriers the students identified whilst on the course later. So how did I get here? Well, in 2017, I watched Dairy is Scary, then Cowspiracy, and adopted a vegan lifestyle. I've always loved food and cooking and enjoyed the challenge of making delicious vegan meals, which turned out to be much easier than expected. I felt better in my own health, particularly menopausal symptoms, and only then did I explore the health benefits of a whole food plant-based diet. I joined plant-based health professionals, I completed the certificate in plant-based nutrition at Winchester University, and impressed by Shireen's drive and determination to make a difference within our NHS, I joined as a board member. I use social media platforms and public cook-alongs to encourage others to see the ease of making healthy plant-based meals. We filmed a series of cook-alongs with educational content for the PBHP website, which you can access as a member under the Cooking for the Climate. But it was the knowledge gap in healthcare professionals that we wanted to tackle. Using contacts and the planetary report card, we approached universities to prompt interest in a plant-based nutrition course for medical students. And in 2021, we held our first Cooking for the Climate adventure as part of the Global and Planetary Health module in Exeter Medical School. In early 22, we had a second course in Exeter and the first in Southampton, and this year we added King's College London Medical School. I also run a community plant-based cook school one day a week and offer educate events to organisations. I bring along a healthy plant-based lunch and lecture on plant-based diet. This is all sponsored by plant-based health professionals. My conflict of interest today is I do sell a self-published cookbooks, Health on the Hob, and a children's book on planetary health available through Helpful Heart Books. Our battle is with the affordability and the accessibility of hyper-palatable, ultra-processed, unhealthy foods, with a disproportionate representation in more deprived areas. Other barriers lie with government, in policy and funding. The Cooking for the Climate adventure teaches there are no healthy people on an unhealthy planet. And on this adventure, we incorporate the impact intensified animal agriculture has on our planetary and personal health. We consider the One Health principle, discussing food, air quality, water, soil, nitrogen, childhood obesity, chronic disease, cancer, etc. We use healthier sources of protein. We include fibre-loaded food as fuel. And we return to the hob to cook easy plant-based affordable meals, aiming to prevent and treat disease as first-line prevention treatment. The Cooking for the Climate is a culinary medicine adventure. It discusses the principles of sustainable plant-based diet, its potential to positively impact global and personal health. The course discusses common controversies and concerns while supporting participants to learn how to cook simple, affordable, accessible, delicious food. And this provides the students with the confidence to incorporate a plant-based diet into their personal and clinical practice. It includes lectures, debate, presentations, role play, and signposting to resources. We incorporate all the social determinants of health, which will be relevant in our practice as healthcare professionals, to recognise the issues with food poverty, to fuel poverty, when we need to be flexible, innovative, and adaptable, and be able to transfer these skills in a consultation. Empowerment with information and transferring this knowledge in a quick delivery takes practice, and the students report trialling their new skills with success. Practice does make perfect, and the dietary history enters most, if not all, consultations. Lack of access to healthy food means we can empathise with home situations of our population. It makes us more inventive and enthusiastic if we've considered these issues ourselves, so we can teach innovative ways to overcome these social injustices. Currently, we've got the biannual course at Exeter, an annual course here in London at King's and at Southampton. PBHP hosts a morning of lectures with a Q&A to the whole Exeter third year medical year group, and we hope to be included in the lecture programme at Southampton soon. The course is built on a Moodle platform, which I update with the help of Nigel Ribeiro from Beehive Learning. It's tailored to each university's SSC needs, and it's built around weekly cook-alongs with discussion, revision of the pillars of lifestyle medicine, and the components of a whole food plant-based diet. This is an example of the intro page, and here's an example of a week activity. I'll meet the students over Zoom for 2 to 3 hours a week, and in this week we discuss the health benefits and planetary impact of avocados. So the students will make a choice on the guacamole prior to the class, and then they defend their decision. These fajitas are delicious, made with Cajun spice rubbed into grated jackfruit, with black beans, mushrooms, peppers, onions, tomatoes, and a corn tortilla, and served with a freshly made salsa and guacamole. We then enjoy our fajitas, listening to me lecture on the trans-theoretical model of change. It's quite dry. And their homework is often a film, such as Eating Our Way to Extinction or Don't Look Up. Here's another example of a session. The students give a 5-minute presentation on an aspect of One Health, incorporating the impact our food choices have. And after the presentations, we cook this delicious barazi, which is onions, legumes, tomatoes, coconut milk and spices, finished off with grated lemon zest, freshly grated garlic, ginger and turmeric, and a squeeze of lemon juice. Pretty much what I'm living on just now, but it is delicious. This is the view in my kitchen setup. I've got 2 cameras of me and my chopping board for the students to see. And here's some examples of the student food. So there's Ollie's MasterChef finale of Vietnamese soft rolls, ramen, and a cheesecake. Katie using the class to combine with meal prepping, By popular request, we did some cookies. There's some other food that we've made, some more examples, and even more. We base meals around the Eat Lancet planetary health plate, showing predominantly whole foods, plant-based dietary approach. And currently there isn't an institution that produces food on to this standard, and very few health professionals are recommending it. Yet this is the best way to tackle our emissions on a large scale. The students will complete a pre and post-course questionnaire, giving us meaningful data on any changes they've made and the impact the course has had. This is an example of the post-course questionnaire analysis, and our results are impressive. This poster was shortlisted for a verbal presentation at last year's British Society of Lifestyle Medicine conference. It includes the breadth of knowledge the students learned, their personal dietary changes, and their confidence in discussing diet with patients. It concluded this course is informative and impactful. The results to date confirm 93% of the 85 students who've been enrolled on the course are confident or very confident to discuss diet with patients after attending the course, with 7% equivocal. 84 of the 85 that have been on the adventure make changes to their personal diet, predominantly for health reasons and climate consciousness. The feedback is encouraging and positive, with students enjoying the course, changing their own behaviours and feeling informed. More recently, there have been challenges with affordability as food prices rocket, and we have explored funding from the medical school. If we look at what else is being done, there's well-known culinary medicine programs run in Harvard and Michigan. And funding has been an issue with other culinary medicine programs. Many have started out as a pilot, as in the UK culinary medicine, within the medical curriculum, and sustainability varies, often with the course becoming an optional elective, an SSC, a student selected component as ours, or a paid course for all healthcare professionals. The overwhelming drive is this is an essential part of our education, but currently it's left to a few to promote. It needs a global consensus, commitment, and funding to be incorporated in every curriculum. I don't think this will work. It's a cooking for a climate, the cook-alongs and the education. If you go onto when you join plant-based health professionals, there's like a little video there. More in-person teaching is held in Liverpool. So we're in 2021, we established Vinnie's Kitchen Community Plant-Based Cook School. Education and empowerment is key for personal planetary health. And in a weekly cook school, I'll provide education in personal planetary health, encouraging our community to reclaim responsibility for one's own health by improving diet. The kitchen space is provided by the late John Richards' company, Samson Security, and it's sponsored by plant-based health professionals. Vinnie's is a safe environment for adults and children from various backgrounds to meet, hear about our whole food plant-based diet, cook and eat together, and then share food with our homeless. We deliver anything from 30 to 90 meals each week, and it's a huge success. I'd like to summarise with these points. It is a basic human right for healthy food to be affordable and available. We need to share the knowledge and wisdom to prepare and cook from scratch in our communities and institutions. Our choice of food helps prevent and treat serious chronic disease. Food is medicine, and healthcare professionals should be equipped with the knowledge and skills to educate and empower patients. We must relate our health to the health of our planet, acknowledging the destruction that intensive animal agriculture is having and promoting a plant-forward diet. Thank you for listening. I'm happy to take questions as part of the panel or by email. I'm on Hayley Tait at livegp.nhs.uk. Thank you.
Thank you so much, Hayley. That was a fantastic talk. I really loved hearing about the Cooking for the Climate adventure. And over to my very esteemed colleague, Sharon Gardner.
This one? Yeah. Oh, okay. Hi, I'm Sharon. I'm one of the many cook and teachers that work with Made in Hackney. So my presentation today is going to be about community cooking and education, a cultural perspective. So a little bit more about me before I start, because I wasn't going to share my journey actually, but after I saw, who was it, Kate earlier on. Oh my gosh, she was so fantastic. After she had her journey, I thought, I'm going to share my journey as well. So how I actually became not just a cooking teacher for Made in Hackney, but also my background in health sciences, a naturopath, lifestyle medicine, and also I teach Pilates. Pilates teacher as well. So all of that. So yeah, my journey started back in 2000, so the mid-2000s. In my mid-30s, I was told all my health problems were down to lifestyle. So, no, age. So because you get older, like 35, you expect to get sick. And you expect to have, I'm just telling you what I was told. So like 35 years old, 2 children, didn't drink, never touched alcohol, didn't smoke, didn't do recreational drugs. So relatively healthy, with regards to my lifestyle. But I was getting hay fever, developed hay fever at about 29. And then in addition to hay fever, I also had lots of digestive issues, so bloatedness, really bad heartburn, all that good stuff you get with kind of IBS. And also really severe migraines to the degree where I had to lie down because pain relief just didn't work. Pain, ibuprofen or whatever. It would paralyze me to the point where the only thing that would work was lie down in a dark room. And then the tiredness. So I don't know if anyone's ever experienced lethargy, where you just haven't got the energy to get up. You go to sleep, you have 8 or 9 hours, but you can't drag yourself out of the bed in the morning, or you go to work, and then by mid-afternoon, you've got that mid-afternoon slump. So that was me. So I didn't drink, I didn't smoke, I didn't do recreational drugs. But that was my life back then, and I was told it's just middle age, in your mid-30s. And then I think the icing on the cake for me, when I started getting this kind of rash, whenever we used to get in the summer, to the degree where it would burn and it would peel. So my skin would burn and peel. And after a few years under the consultant, he told me I was allergic to the sun. So I said, okay. I was like, right. First time I've ever heard of someone that looked like me being allergic to the sun. So a friend said to me, you should look at your diet. So I said, what do you mean look at your diet? Look what you're eating, see if there's anything in there that could be affecting you. And that's when I began my journey to become, first of all, vegan, and then plant-based, and then now, my background in health sciences, a naturopath, and a teacher of Made in Hackney. So that's just my background. How do I turn this? Up and down. I'm trying to move it. How do I move it? Which way? Okay. This is my Caribbean family, okay? Just some of us. So according to the stats, we are 3 times more likely to suffer from diabetes than our white counterparts, okay? So that's, and then also, we also suffer from higher rates of hypertension, stroke, and chronic kidney disease. So that's just stats for anyone from African or Caribbean backgrounds, okay? So this is my lovely family. That's my daddy, just passed recently. Unfortunately, he had prostate cancer. And so that's also something that's very kind of high rates of prostate cancer within African and Caribbean communities as well. Okay, so I just want to show you a little bit about this stats so you can see what it looks like. So this is a Caribbean, a regular traditional Caribbean family, all born and raised here, but with Caribbean heritage, apart from my dad, obviously. Okay, so health determinants. According to some of the stats, the reason why we suffer with diabetes more than anyone else and the other kind of hypertension and kidney disease is because we have lower levels of recommended daily proportions of fruits and vegetables. Okay, that's one thing. We also have higher levels of obesity, so we tend to carry more fat around the middle in our communities, and also being bigger in African and Caribbean communities is seen as kind of it's wealth and it's health, depending on where you're from. And also lower levels of a physical activity, but I thought I'd put Usain Bolt up there just to show you that it's not quite the case for all of us, but for some of us it is. And we've also got Shelley-Ann Fraser as well, Price, because it also says that women particularly have lower levels of physical activity within African and Caribbean communities. Okay? Let me go back. Don't want to show him yet. So, diet and culture. So, as you can see, we've got a West African market here. We've got a Caribbean market there. Very similar in terms of the produce that they sell or they have access to. So, depending on whether you're from West Africa, why did it go back? I didn't touch it. Sorry, guys. Okay, it's doing its own thing. Is it on a timer? Okay, I'm going to stop. Okay, so I just want to talk a little bit about the diets, West African diets, and not even just West African, just diets for Africa and the Caribbean. So they're very similar, as you can see, in terms of the produce that you can see on the images. Okay, but culturally, they're very different. So in West Africa, you've got maybe Nigeria, Ghana, Sierra Leone, and then some other countries there. And then the way that they cook their food is going to be different to how we in the Caribbean maybe cook our food, or those of us with Caribbean heritage, okay? I don't know what's happening. Okay, so... Okay, I'm going to keep talking. If it changes... Okay, so just very gently. Okay, thank you. Okay, so basically, what I just want to show first what it is like in these countries. So if you go to an African country, or West African country, or a Caribbean country, you'll see this as part of the food that's on sale or on offer. So we will have, so what we both use, a similar food that we both have within the Caribbean and, okay, I'm gone now, it's gone. Should I point it here? Oh yeah, it's a bit glitchy. I don't know if I'm pressing the right thing. Okay, so this. Okay, so for example, we've got a yam there and a cassava. Okay.
Just use the arrow on as the keyboard, not that.
There. Yeah, that'd be better.
Does it not work? No, it doesn't work.
Okay, so we're right here now, so that's good. So I just wanted to show the similarities between the foods that you'll find like in African and Caribbean diets. So we're talking about culture here. We've got a yam and we've got a cassava. So somewhere like West Africa, they would turn that yam or that cassava into something called fufu, okay? And that's just really, it's a starchy root vegetable that is kind of boiled and then beaten down into a kind of like a mash, but then it's used to eat with the stew, okay? Whereas in the Caribbean, we usually have the same food but have it boiled in a soup or on the side of a plate with other types of vegetables and some meat or some fish. So it's very similar in terms of the food produce, but different in how it's prepared. And you'll understand why later on when I talk a bit more. Okay.
So this one is back, I think.
It's going backwards.
Really strange. It's just not working, to be honest.
Oh, it's there now. No, I think so. Okay, I think that's it. I think I'm right. No, it's gone too far. I should be on 5. Yeah, so... Okay, so go to 6 now for me, please. Okay, right. Okay, so just wanted to point out the history of plant-based diets in the Caribbean. Okay, so back in the 1930s, the Rastafarian movement began. So as you can see, ITIL was vital. So basically what happened is that it was born in Jamaica, and it followed a primary vegan and plant-based diet, which referred to as ITIL, deriving from the word vital, okay? And the food was cultivated and harvested from the land and cooked with freshly made, usually coconut milk. So you get the coconut, you'd turn that coconut into milk, and that was the base for a lot of the cooking. You'd also use fresh herbs and spices, no salt and no butter, and they embraced the health benefits of a plant-based diet long before it became trendy, okay? So really... Most people know the really kind of famous Rastafarian would have been Bob Marley. So this is kind of 1930s, almost 100 years of the Rastafari movement, not just in Jamaica, but right across the Caribbean and also in parts of Africa as well. So you can see that was something that even before we knew about veganism, about plant-based diets, it was something that was practiced in the Caribbean and now in parts of Africa as well. Okay, I think I need my next one, please. Okay, and this is just a little bit more about Africa's plant-based history. So Africa was actually also traditionally plant-based within the continent. And the indigenous foods included things like yams and cassavas and sweet potatoes, maize, leafy greens, legumes and groundnuts. Okay, many of the sauces also that they use are cooked, usually using like leaves, like sweet potato leaves and cassava leaves, and resemble really hardy spinach. So the plant-based history of Africa is very similar to the Caribbean because, as you know, there's a lot of Caribbean people may have their history in Africa as well, particularly West Africa. So a lot of the foods from West Africa would have made their way to the Caribbean. So with regards to meat was an expensive luxury. So it wasn't eaten often, it was eaten very rarely. And when it was eaten, it was usually a special occasion. So meat didn't really become that popular till more recently. So I think I'm going to compare the Eat Well plates now. Okay, so the first one was that's the second one. So the first Eat Well plate is doing its own thing. So that's kind of the one we get from the general one from the government that says, this is the Eat Well plate. As you can see here, we've got a selection of veggies, fruits and veg one side, your starches the other side, and then you've got your protein. There are some plant-based options there, but you've still got your meats and fish and your eggs and the dairy. And then if you look at the African and Caribbean one, you can see with a lot more choice of produce there, and the grains, etc., and starches. So compared to the general one, there's a lot more variety there. Yeah, there are meats and fishes on there, but you've also got a lot more fruits and vegetables on there that you may not find on the general, the one provided by the UK government. And the next one is our Made in Hackney one. Next one is our Made in Hackney one. There. Oh. And that's again, once we've got the actual plant-based protein options there, and then we've got non-dairy alternatives. So for me, what we can do, or what can be done, is that you can combine maybe like a Made in Hackney one with the African and Caribbean one, just to give a broader range of foods that those from African and Caribbean communities can eat, okay? So next one, please. Thank you. See, it's not just me then, The one before. It's not just me. I thought it was me. Okay, community cooking. So this is the Made in Hackney kitchen. I thought it was just me. Yeah, okay, it's okay. Don't worry about that. Okay, so what do you want to talk about as a teacher for a Made in Hackney? I get to work with lots of different types of communities. And one of the most important things for me in working in the kitchen is putting nutrition into practice. So you can tell someone to eat whatever it is they need to eat, let's say more lentils, for example. But unless you show someone what to do with those lentils, they're not going to know how to prepare it. You know, lentils are so versatile. For example, you can make that into a stew. You can make that into a curry. You can use it, put it into a pie. You can make, shepherd's pie or shepherdless pie, as we call it, or shepherdess pie. You can use that make that into a bolognese. So it's a very versatile food source, pulses and lentils. But until you actually go into a kitchen and show people what to do with it, they're always going to think, well, what do I do with this food? So this is why having places like Made in Hackney or community cooking classes are really important when it comes to showing people how to put nutrition into practice. So one of the other things that I'm able to do as someone with a Caribbean origin, I'm able to do culturally appropriate foods using plant-based ingredients. Okay, so I can do like a jerk lentils, and I'm not going to be appropriating someone's food because this is what I grew up with, jerk lentils, for like jerk, using jerk seasonings. Or I can do a jerk jackfruit, my favourite, okay, something like that. But you're able to actually show people from Caribbean origins, from African and Caribbean, backgrounds, how to put the food into practice and they're not missing out on flavours, they're not mixing out on textures, and you're just basically having a meat-free option. And this is what they want. They want you to provide them with meat-free options. They're not really big on labels like vegan and plant-based. But if you can maybe say, okay, so here's a meat-free option for you. Why don't you try and make this stew with some of your traditional beans and legumes as opposed to your usual meats and fishes? So that they have options, but you've got to make it culturally appropriate, and you've got to make it's got to taste good. So they have to have those spices that they're familiar with or the herbs they're familiar with, so that they can always go away and feel like they've eaten something really good that's not only good for them, but also tastes like the traditional thing. Okay? So all I want to end with there is, so I just said what I had to say, so this is my family again. I want to end with my family because, according to the stats, we're more likely to get diabetes and high, heart, cardiovascular disease and kidney disease. But if we just use that education and we're able to provide alternative, not even alternative, just provide them with the same types of food, but have meat-free options and use culture-appropriate food for them, then that way we can reach a wider group of people when it comes to doing these type of things in the community. So hopefully that has been useful. Sorry about that.
Stretch and a shimmy. I'm so sorry about your clicker, Sharon. What a curveball.
Thank you.
Little wiggle. Okay, Marisa, you're up next. I don't know how you feel about the dreaded clicker. Is there anything the tech team can do up there about the clicker? Could you come and have a look at it? Or next, brilliant. Next slide. Okay. Thank you.
Wow, I mean, those three presentations, so engaging. I'm not sure how I'm going to follow on from that, especially when I'm going to be talking about government policy, which is a really dry topic. So thanks for putting me last there to come up to that challenge. My name is Marisa Heath and I run the Plant-Based Food Alliance. My background was originally animal welfare. So actually, no, my background started in defence, believe it or not. And I was working advising politicians and writing about defence policy and things. And I thought to myself, it's not really what I'm passionate about. So I started working on animal welfare, and the objective of that was I wanted to change government legislation in order to protect animals. I found myself working a lot with farm animals. I was visiting abattoirs, visiting farms, learning all about it. I was a vegetarian at the time. And then one day I was in an abattoir, and the worst thing I saw was the last cow that came off the truck, and she was so dejected and so depressed, this animal, and she looked like a bag of bones. And I said, why is that cow different to the other ones? And they said, oh, ex-dairy, she's end of life, no good for us anymore. So I went home that night and started researching, and that was 2009, and I became vegan and have been vegan ever since. I carried on working on animal welfare legislation, and then one day I got a phone call from a set of companies, Danone, Oatly and Upfield. Upfield, if for any of you who don't know, does VioLife and Can't Believe It's Not Butter, those sorts of products. And they said, we want to set up a plant-based food alliance. We wanted it to focus on trying to change the government's position, because at the moment, and I'll explain to you why, the government's not very helpful when it comes to transitioning to plant-based diets. There's numerous reasons why, and numerous reasons why we need people like you to be really engaged, because we have to change this and we have to put pressure on government. So my background, changing legislation, I thought, wow, this is a bit of luck. I'll actually be able to do something really meaningful now with plant-based. But it's been one of the most challenging areas I've gone into, frankly. When I started in animal welfare in 2006, 2007, it was really low on the government's agenda. And actually, we've had numerous pieces of legislation since that time. So we have seen a turnaround on that. There's still lots to do, but the UK is one of the leading countries when it comes to animal welfare. But when it comes to talking about diet and nutrition and changing food systems, government, frankly, does not want to have this conversation. Can we move to the next slide? Thank you. So just before I start talking about that, I just wanted to set out who our members are and who we work with. We spotted plant-based health professionals very early on, and I thought phenomenal. I hadn't known about them, and I was like, that's possibly the most exciting space to be in, because these are people that are trusted and respected. So I was really keen to have conversations with them, and hence why I'm here today. We work with lots of different organisations. These are our core members, but actually I have to give real dues to Outpro, Upfield and Oatly because they haven't just done this in the UK, they've done it internationally. We've got plant-based alliances in America, in Canada, in China, in India, in Mexico and in Europe as well. So the sector is starting to get organised. It's good news. And we've got our first international conference in Brussels at the beginning of October, and the reason why this is so important is because the other side, as I call them, the livestock lobby, are incredibly organised. They've been doing this for years, and all of those things that you see in the press and all of the attacks, they don't happen by accident. The whole plant-based is ultra-processed, plant-based is unhealthy for you, plant-based is unsustainable, blah, blah, blah. They come from a very organised lobby. So we have to get organised as well. We've got to all come together as we're doing today and keep doing this and keep sharing the messages and keep making sure that we're out there saying why we are the future, because I've got no doubt we are. And I sit in government a lot of the time and I feel, God, this is just a nightmare. I'm going uphill, what is it, pushing water uphill, all of that kind of thing. And people shout me down and people say, oh, you know, vegans and you don't know what you're talking about and all of this kind of stuff. But I know one thing for sure, and that is it is not sustainable to carry on producing food the way we're doing. It just cannot happen. And I think we are seeing a change. I think people are changing, particularly younger people as well. And the government is going to have to listen at some point. So all of the work we're doing coming today, right down from the community food, it's all the green shoots that are going to lead to our massive forests in the future. I'm absolutely positive of that. Next slide, please. Why is this relevant to cooking in the community, you might wonder? Why am I suddenly finishing this off? Well, government policy can be the absolute driver or the blocker for what happens in communities. Their positioning on how they subsidise, and they do, they give money to different food areas and things, they've done it for a long time. Their direction on health, what they say from the Department of Health and what they're putting out there for practitioners to do. Their conversations about nutrition, they're often behind very big entities that are saying you must eat meat because otherwise you'll crumple and turn to dust, that kind of thing. And the education programmes all have a really big impact. So basically the Alliance is there to try and change that policy and to get in and to say no longer are you keeping this sector silent, we want a place at the table as well, because for a long time we've been excluded from that. Next slide, please. Can you click a couple of times? There should be more things, yeah, and then another one. Okay, so what are the policy issues? What are we tackling here? The top item on the government's agenda is economic. It always is economic, basically. So we've got real problems of growth in the country. We've got more national debt than we've had since 1960, I think. We're at 100% GDP at the moment. We haven't invested in infrastructure. We've got some economic problems, I'm afraid. Even the news last week about our growth being larger than we thought is still a problem. So that's what the government cares about. The government also has on its table at the moment the health challenges. 7.7 million people, I think, still on the NHS waiting list. NHS, again, not being invested in. Lots of the buildings, the equipment and things hasn't had the right investment. A problem with GPs walking away, shortages there. So health is a really serious issue and it's one the public care about. All of us in here as taxpayers, we have paid into a system that we expect to be able to use, not to have to sit there for 5 or 6 hours to wait to go into an emergency or wait months and months for an operation. So this is politically a really toxic issue. Now, somebody mentioned, I think it was Hayley, said about the short-sightedness of politicians. The NHS, when it was set up, was there to treat injury and infection, and now it treats chronic disease. That's what it's fighting against, and yet no one will sit and say, why is that? Where is this problem and how do we tackle it? Because they're all too busy saying we've got 4 years till the next election. How do we get there and win the votes? So nobody wants to take this politically hot potato and deal with it in the right way. And that's something that I think is our real advantage, as you've heard over the last 2 days. We've got somewhere to go on dealing with this problem because I don't know how they're going to manage it. We don't have more money to keep putting into it. So the only thing to do is try and tackle those long-term health problems. And we also know we've got a massive growing issue around mental health. I'm not a doctor, but I've read enough research papers that show that diet is linked to mental health problems as well. So we've got to get hold of this at some point. Tech and innovation, the government's really interested in that because it thinks that's what's going to save the day. We're going to get ourselves out of trouble by being so clever that we're going to invent everything. But we've got space here, we've got skin in the game, because it is innovation technology that's creating the food of the future. Predominantly we're talking about more plant-based food today, aren't we? And for me, that means more legumes, more fruits and vegetables and things like that. But we have to factor in convenience food too. People do want to be able to go out and buy the replacement for chicken, buy the burger when they want to, the hot dogs, the cheese, all of those sorts of things. We've got to get that right. So we have an answer to that. And actually, I went to the corn factory just about in Yorkshire 2 weeks ago, and I was really surprised to learn that actually in the 1960s, the government said we're going to have a protein shortage post-war. They were really worried about what they were going to do. So they set up the research into microprotein, which is what corn started from, and 20 years of work, they came up with this incredible thing. If anyone doesn't know about microprotein, you could do a whole lecture on that. It is the most phenomenal thing. The government was behind that, and as it was working, it suddenly realised, but there's intensive farming. Which way should we go? Should we go with microprotein and that innovation, or should we go with intensive farming? It went with intensive farming, and it dropped that, and corn carried on doing the work. And as you know, it's a strong product now, but it's not nearly as big as it could have been if it had carried on having that energy and government investment to it over the last 40 or 50 years or something. Net zero. I'm sure like you and I, you're kind of tired of seeing the arguments about net zero in the press. 1 minute it's like, yes, let's do it. The next minute it's like, oh, shall we not? It might not be very popular. All of this dancing around. But again, we know we're seeing net zero having a massive impact internationally, particularly on Asian countries with all of the flooding and things at the moment. It's here, it's happening, it's real. I believe the majority of scientists, not the couple of kind of crazies who come out and say it doesn't exist. Net zero is an issue, and food is not being had in this conversation. We talk about cars all the time. We talk about changing people's heating systems and all of this kind of thing, but we're not talking about food. So that has got to be an area that's spoken about a bit more. And then nature recovery linked into that. One of the most nature depleted countries in the world, the UK, we've got a real problem with it. And the government have done some useful things. They brought along an Environment Act that said we were all going to have local nature recovery strategies. And even for those who don't care so much about net zero, I don't find many people that don't care about nature. I think most people care about wildlife and nature and want to go out on their walks and things. But again, it's all very well just like looking at small spaces, but overall we have to look at the whole world as nature recovery, and we cannot carry on using all the land for animals. We don't need to tell you in this room how much land is used to raise animals and raise their food. Broader issues, world population, I've already touched on this. We need 50% more food by 2050, I think, in order to feed the world population. So it's just crazy that anyone's thinking we can do it with animals. It just makes no sense, unless you're going to go for the China model of high-rise blocks of buildings with animals all the way up to the top of it, which is ethically completely wrong in my mind, but also just waiting for disease outbreak and all of the problems that come with that. It's not going to happen. So why wouldn't you be preparing now to deal with that as governments? The Sustainable Development Goals, everyone's signed up to them, so make them happen then. It's all very well signing the bit of paper and saying we all agree we want to get rid of world hunger and things like that. Actually make it happen in your own backyards. I've just mentioned the climate change, particularly in Asia. A lot of the argument that comes back is, oh yes, but developing countries and countries that are developing more wealth, they're eating more meat, so we don't need to cut down because even if we do, they're going to eat more anyway. The reality is that those countries too are seeing the impact of climate change, and one way or another, China economically will see the ramifications of climate change, and that will force them to change. And from our Plant-Based Alliance in China, we are seeing movements there as well from the Chinese of how to move into technology and innovation in this space. Eat more plants. What a simple message. The government has a health problem with people not having enough fibre and vitamins, not having access. It just ditched its horticultural strategy a couple of months ago, which was how we grow more food in this country. We're all talking about cost of living. Well, that's because we're importing a lot of the food. We don't have the control over it. Why would we not just want the simple message of eat more plants, grow more plants, have a proper strategy in this country, make that food accessible to communities, make it affordable, give them access to it. That's the first thing. If the thing that you go into the supermarket, the thing that's in front of you, the food that's being subsidised, that's cheaper to get to, that's what people are going to have, aren't they? It's not rocket science. Next slide, please. These are the issues we're working on at the moment. These are very much live issues. So the government had the cunning idea that they should have a food strategy. Seeing as food is pretty much, apart from water, one of the most fundamental needs we've got, a food strategy seems like a really sensible thing for me. Should have had one 20 years ago. But anyway, they decided it would be a good idea. So they've done that food strategy, but it doesn't mention plant-based. And actually, it's gone to court. It's got a legal challenge at the moment over it about what the reduction target needs to be for meat and dairy. Because if the government can come up with a target and say, we need to reduce meat and dairy by 30%, that gives us an objective. That's the area we have to fill. Our businesses have to be able to get into that area. And we know as practitioners and people working in this space, that's where we're going. They haven't done that, but it'll be really interesting to see the legal case on it. And the food strategy, there's an amazing document written by a man called Henry Dimbleby, who was commissioned by the government. He started the Leon restaurant, and he's just written a book. I don't know if anyone can remember the name of it. Ravenous, that's it. Really easy to read. If you want to understand policy and all of the way that the food systems work, how they're subsidised, how they're manipulated, it's a really good book for doing that. He wrote the government a paper. It's really comprehensive, gives you loads of information, statistics, tools, all you need, particularly if you're an academic in this room. The government ignored it. But it still exists and it's still useful, and we'll see if it comes forward. Good Food Nation, Scotland are doing their own thing, as Scotland sometimes do, so they've come up with a Good Food Nation, and as part of that they've said that every public body, including health, now needs to come up with a food strategy of their own. So for normal people like us, there's an opportunity here. We can get in, and this isn't limited to Scotland. Scotland have come up with this model, but also around the rest of the UK, because entities have got bored of waiting for government to decide what they're doing. They're setting their own food strategy. So I'm involved in the Surrey food strategy. And that's an opportunity for, we've got health practitioners involved in that, students, climate change experts, dietitians, all sorts of different people that are helping us set that strategy, because then around Surrey we can go into the schools and the health centres and we can look at public procurement in those areas and things and get people to change. So that's a really tangible way to really get a grip on trying to influence yourself on things. Future farming, one good thing that came out of Brexit, I suppose, if you want to look for any good things, was leaving the common agricultural policy. So that subsidy was very set up in favour of livestock to a large extent and old systems of food, and the government have done a good thing. I'm being quite fair, I'm being negative and positive at the same time. The government have changed the subsidies so that it supports what they call public good. So they say when a farmer looks after his land better, when he plants more trees, when he puts hedgerow in for biodiversity and habitats and things, then he can access money. I shouldn't say he, should I? They can be he's or she's in farming. So they can access more money. So that's a positive thing that lands in our favour. The obesity strategy, oh gosh. I don't know what number obesity strategy it is, but it hasn't really worked, has it? So obesity strategy, as I said, I'm not the health expert here, but I've read numerous papers that show that plant-based diets can really tackle obesity. So why are we not at the fore and centre of the obesity strategy? Why isn't government setting that right in the middle of that strategy, saying you need to talk to people about plant-based diets, we should be promoting that and things, and they're not, which just shows the massive hole here for our influence at the moment and why we need to scale that up. Food security. The government is worried about food security, quite rightly, because when we see the climate impact that's happening, whether it's the war on Ukraine, whether it's wildfires or flooding, food security is a problem. And when the demand for wheat and things like that goes up, it makes it more expensive in this country, and that's when the voters start getting hacked off because the price of bread and things has gone up again, and they blame the politicians for that. So food security is a thing. We can grow a lot more food in a plant-based setting than we can animal-based food, so we can tackle that. Not only that, with innovation and technology, we can grow things in different arenas, whether it's vertical glass houses, whether it's in laboratories, however it is, we can grow more food. So you tackle that food security issue, and also by having more fruit and vegetable grown in the UK, which is now becoming a very good climate for it, you solve that problem from relying on imports and exports elsewhere. Public procurement, what a massive opportunity. £2.6 billion is spent on public procurement, a huge chunk of that into the NHS, care homes, prisons, places like that. If we could even have a percentage of that, if even 20% of it was for plant-based, that would give my companies under my alliance some sort of security At the moment, everything's funded by themselves. They're having to deal with all the changes in the market and things, unlike the livestock sector, which gets subsidies and supports and things. So, having public procurement go in our favour would be massive. And I think that the stuff they're doing around universities at the moment is a really nice example of the plant-based university call-out. I don't know if anyone saw the letter last week, but getting universities to change is a real core part of that. I've mentioned net zero, so I'll move on because I know I'm running out of time. I can probably cover some of these things on the next slide, if you go to the next slide. So there is a committee called the Scientific Advisory Committee on Nutrition, and it advises government on scientific aspects of nutrition and health relating to the population. There's also a committee called the Committee on Toxicology. These two committees have come together to do a benefit and risk assessment, considering both nutritional and toxicology aspects associated with consumption of plant-based drinks. And with that advice, they will then advise government how to set its policy, including in the Department for Health. Now, the problem with that is they're not taking into account any fortification. So they're looking at dairy completely compared to plant-based, and they are, we think, likely to come out next year and say plant-based dairy cannot compare nutritionally with animal-based dairy, and therefore is probably not appropriate to give to young children as part of a balanced diet. That's a problem for us, because the Daily Mail and those sorts of papers are going to love that headline, aren't they? Plant-based dairy is rubbish. Don't give it to your children, it's really bad for them. They're twist it and turn it and get it into that kind of area. Again, it's back to this unfair playing field. So cows are given B12 as a supplement into their milk in order to put it in the milk, but that's not taken into account because this committee is only looking at the end product. As I just mentioned, it is also not looking at fortification, and fortification has a massive role to play in dietary, producing of food and things. The conversation before lunch where he was talking about the amino acids and, sort of saying plant-based meat would need to think about fortification. These are all absolutely right. We should be thinking about fortification. But if the government is going to say it doesn't count, then we've got a huge problem when it comes to messaging, because as much as politicians are distrusted, when the Department for Health puts out a thing saying plant-based milk isn't great, people will listen to that. So these are the kind of things we're firefighting. We're not only trying to get on the front foot here by saying, well, we're so good, we're dealing with all of these kind of things coming at us. Another issue, dairy denominations. So some bright spark had the really good idea to go against us for using things like plant-based alternative to mozzarella or plant-based alternative to cream, or misspellings where you spell milk MYLK. Basically, there's a bit of a regulation they've interpreted that came over from the EU, which says we shouldn't be doing that. We've done it for 20, 30 years, but all of a sudden they've said we need to start enforcing this. We need to send council officials into the supermarkets and get these products off the shelves. So they're doing a guidance note at this at the moment, and so far we've successfully fought it for the last year, again using our money, our business's money, for lawyers, for having to work around this, when in fact what we could be doing is funding better products and better nutrition and things. Instead we're fighting something ridiculous like this. It was all done under the cover of darkness. I only found out about it because one of our members, Outpro, Danon, obviously wears two hats, dairy and plant-based. So they found out about it through the dairy connections, and it was being driven by Dairy UK to go and do this. So we've spent a huge amount of our resources, the Alliance, is fighting something so ridiculous. And you cannot tell me that a member of the public goes in and buys a bottle of plant-based milk and comes home and goes, oh, God, I'm tricked. I've been tricked. I really thought that was dairy. It's pretty obvious when it says plant-based. Our USP is that we're not animal-based. That's the point. We don't want to be quiet and secretive about that. We want to tell people. And yet apparently we're deceiving the public through this. So these are the kind of things we're battling. ISO, plant-based definition, this is the International Standards Organisation, and at the moment they've decided that the definition for plant-based needs to be different to vegan. So they've come up with, again, a really cunning plan. Someone's thought about this really long and hard, and they've come up and said plant-based should allow 5% animal derivative. That's what will make it different to vegan. That's a good idea. So at the moment, they're deciding, the meeting's at the beginning of October, whether to adopt that international principle, which as far as I'm concerned, and I might be a bit cynical in my old age, it's another way of animal getting into that kind of area and being able to have 5% of our market. Yeah. I mean, it's just crazy. So we're fighting that like mad as well. UPF, the ultra-processed food health debate, there's an organisation called the Agriculture and Horticultural Development Board, and it exists from subsidies from the meat and dairy industry, and it uses that money to come up with marketing and campaigning. and it's got a lot of money, millions. The Alliance is a tiny little sort of mouse-like thing living on a bit of money. This has got millions, and it's come up with a big strategy about how do we keep people eating meat and drinking dairy. It's really important because we can see change happening, and we've got to make sure that our market doesn't shrink. So they've come up with a big campaign of promoting meat and dairy. You might have seen some of the adverts on television and things, and they do link up with international organisations as well to do this. The ultra-processed food thing hasn't come from just nowhere. We're all talking about ultra-processed food, I know, across the board, but why is it being focused at plant-based? Why is the narrative being so strongly aimed our way when loaves of bread are ultra-processed, when cereals are ultra-processed and things like that? Why is it just plant-based that gets pulled into this? That's not accidental, so that's a fight for us as well. Resources for the meat sector, the government always thinks about the meat sector. When I go in and speak to the Department for Environment, Food and Rural Affairs, I go to the meat and dairy department within there, because they don't have a plant-based representative. They don't have anyone to speak for us. So I have to speak to that side of the fence to say, why when you did the European trade negotiations for products moving in and out, which is it's called the border operating model, which is about to come in, did you just forget to mention plant-based? You haven't given us any kind of lines. And in fact, you've given us higher prices for us to import plant-based foods in than it costs to import meat and dairy in. Why? Well, because they haven't got anyone championing for us in that department. So that, again, it creates this really unfair level playing field. It's a real problem for us. But it's not all bad. I don't want you to go away thinking it's terrible, because actually the Department for Business and Trade is really interested in our space, and they are trying to promote plant-based. So there is good things happening as well. Next slide, please. Yep, sure. Yep, I will wrap it up. That's just a list of things. You can just read that. I won't go through it. It will take too long. If you want to go on to the next slide, I'll wrap up quickly. So if we can remove the obstacles from government and get more community messaging, then we get more community embracing plant-based, basically, is what I'm trying to get to. Government is standing in our way at the moment, and we need to change that. And the only way you do that is by numbers and lobbying and raising the issue. We have to get in there. We need to be writing to MPs, we need to be writing to ministers, even to local councils saying, are you going to shift, are you going to move to plant-based food as part of your net zero strategy and things like that. It's really important. There's lots of things happening. Community kitchens are cropping up all over the place to deal with cost of living, so we can be going and influencing those. Fair Share have been in contact with us. They're really interested in moving to more plant-based diets and things like that. We have to find ways of supporting low-income families, because plant-based at the moment is more expensive often than other products because it doesn't have the benefits from the government support and things. Health professionals are trusted, frankly. Politicians aren't really trusted, are they? So I think the health professionals, people like that, are at the forefront of communication of communities, as are these guys. So we shouldn't underestimate how much can be achieved by those out there. But as I said, it will all be expedited and grown much faster if we have government policy working for us. So I would just advocate today, and the purpose of me coming is do these kinds of things, get in the community, but also if you haven't got time because you've got long hours, professional jobs, just drop an email to your local MP, do those things. Even if they ignore you or send an annoying message, you're getting in their heads and you're showing we're not going away. And I can't tell you how much that will help us. Thank you, and sorry for going on a bit long.
Fantastic. Thank you so much, Marisa. It does instill me with hope that we have powerhouses like you fighting our corner. So a big, another clap. Definitely some classic choices of phrase that made me tickle. That I often think
you get a bit intolerant after a while.
Yes,
you just got to say it how it is.
Exactly. I mean, and working in the charity sector for 11 years, when we started Made in Hackney, I was convinced that all the environmental funders within 5 years would have diet change on their list. I'm still waiting 11 years later for diet change to appear on environmental charity funding list. It's all conservation, gardening, etc. Never, ever diet change. I'm still waiting. So, it's very frustrating, kind of feeling like you're knocking your head against a brick wall. On to some questions. So we've got a few questions. Let's kick off with this one. Are there any comparison studies around cooking and education which look at the efficiency of digital versus in-person interventions? There isn't, because it's so new. As far as I'm aware, there's nothing that looks at the polarity between the impact of doing an in-person cooking class and online. We know from our participants that some people who are housebound and have health issues, etc., find the online format really, really helpful, whilst, of course, other people love the in-person format because the ingredients is provided and you really develop personal interactions, in those face-to-face cooking classes. So there's a little bit of both. If you've cooked food in your own kitchen, maybe you're more confident to repeat that process. So with an online class, you've got that benefit versus doing it in another cooking school. Let's go to another question. Sharon, could you share a little, they've disappeared, I love Slido. Could you share a little bit about, it's gone, here we are. Someone says, I'm a dietitian in Brixton. Can you give me some advice for encouraging lower GI carbohydrates in African and Caribbean people?
Oh gosh, lower GI carbohydrates. Oh, it's tricky because our food is so starchy. It really is starchy. So it's just maybe you reduce the portion sizes and add more greens in. That's all you can really do with culture. Is it you? Yeah, reduce the portion sizes. So when they've got lots of, we've got the yams and we've got the cassavas and they love rice. So rice with everything. So just maybe show them how to create a plate with less of the starches on there, especially their traditional foods, and just maybe fill it up with more green. Yeah.
Because basically, you've got the normal wheat bar guide.
Yeah.
It's really easy, you say brown rice, brown pasta.
Yeah.
When I use the fountain African Caribbean one,
Yeah.
especially say for example, just having inshimi or fufu and just maybe one main meal.
Yeah.
The only option I've got is like quarter plate, the hard food or the inshimi.
Yeah, the hard food,
half
yeah.
a plate of veg and then quarter plate of the protein mixed food. So I'm on the right track.
Unfortunately, yes. Yeah.
Fantastic. And then we've got Marisa for Prime Minister, so not really a question, just a statement.
I agree.
I like that.
We've got a while to go before politics allows us sort of people in it.
It's true.
Maybe one day.
And also to you.
I don't know if you're aware, Hayley's behind you.
Oh, yeah, Hayley. I'm so sorry. I forgot about you, Hayley, but I won't now. I'm so sorry. Another one for Marisa, then I'm going to give one for you, Hayley. Thank you for the flag. Do you have any Plant-Based Food Alliance templates, letters that we can use to contact our MPs, councillors, NHS, etc.?
It's a good idea, and actually it's probably worth speaking to plant-based health professionals after this about whether we can do some sort of policy stuff to get out via the networks. So I could do that. We haven't done it yet, but we could, couldn't we? Yeah? Good idea, whoever that was.
Fantastic. So for Hayley, how do you fund your endeavours and how do you go about securing kitchen spaces and other places to pop up and do your education work?
So I'm really fortunate currently that Plant-Based Health Professionals sponsors Vinny's Community Plant-Based Kitchen. The Educate events, again, I'll take a big free lunch to any GP surgery and provide a talk free of charge. That was actually offered out to everybody, and so far I've only had 4 take it up. So again, it's just a sign of the times, really.
Okay, thank you. For Made in Hackney again, I'm interested in you teaching Caribbean. I'm interested in your teaching Caribbean and West African cooking classes for HIV positive people. So is that that's not a question? Is that you? Okay. So we have done some classes for HIV patients, quite specifically that we've always had run by plant-based dietitians and nutritionists with NHS qualifications. Quite a few of our cooking teachers are home chefs, home cooks. When someone's got a particular health need or condition, we always use a medical profession to do those classes. We work with partner organisations, so other charities that are supporting those groups of people. We will partner with them and then go into their sessions with our cooking classes, because building those bridges of trust, if we just whacked up some posters, I don't think anyone would come. So I think working with the organisations and charities that are already supporting people with specific health needs, mental health needs, any type of need really, if you go into that venue and use that meeting space to do your cooking sessions, we've found that's worked really well for us. But what did you mean by that question?
I'm going to be starting a new job at the Northwell Market in UCLH in HIV care. And it's going to be more about health promotion and prevention. So I'm just basically trying to find who my partners are going to be and how we can get people the help that's going to matter to them. It might not be actually specific, it might just be finding one of your kitchens and they'll relate to that more and then we can throw it in there.
We also find before doing a 6-week cooking intervention or a 10-week cooking intervention to spend one sort of 40-minute session really doing what are the challenges, the problems, the issues, the desires amongst that group so that a course can be completely co-created. So there's that sense of ownership and empowerment rather than just, I'm coming along with all the answers and I'm going to teach you. That doesn't kind of go down so well. So having a really personal session with the group of people you're going to teach and co-creating the course together is a really good kind of approach we've found.
Hayley's got a message.
Hayley. Oh yeah, great. The universities do pay for the SSC as well. Please reach out if you'd like an Educate event. Thank you, Hayley. Thank you very much. I have a question for all three of you. If you were suddenly made in charge of UK food overnight and you had a magic wand and you could make anything you like happen, but it was just one thing, I'm afraid, just one thing, what would it be? We'll start with Marisa.
Careful, I'll be another half an hour.
Just one, that's
Okay,
one thing.
One thing, ban intensive farming.
Ban intensive farming, yeah, fantastic. Hayley, what would be your one thing?
Pretty much open all the cages till every cage was empty.
Oh, wow. Sharon.
Oh my gosh. I was going to say reclassify what food is. Because I think there's this conception of like a potato's a potato, but crisps are not potatoes, they're crisps. Do you know what I mean? So when you're saying like someone's having chips or something that's brought from a shop as opposed to chips you've made from home, they're two totally different types of food. So reclassify food.
Interesting, I like that. I think if I had one, it would be to have, like the universal basic income scheme, but it would actually be for plant-based ingredients, and every single person in the UK would have an equivalent budget to spend on fresh plant-based ingredients. If you couldn't cook, because working at Made in Hackney, some people cannot cook. You can become a real snob about this, about everything has to be cooked from scratch. If you can barely move, or if you're really struggling, you're ill, whatever, you cannot cook, you need a ready meal. So I would have a government ready meal scheme, really beautifully branded, really good quality, and you could have that, or you could have your plant-based vouchers, and everyone would get it. No means testing, available to all. Yeah. Shall we do it tomorrow? Shall we start? Yeah. If there was sort of one particular challenge that you really felt was blocking the path to a wider spread plant-based transition, what do you think that challenge is? Marisa, the biggest thing.
Well, it's money, it's economics at the end of the day. We haven't got a system. So food, we should have looked after some areas, and we should have made good food more affordable and stopped making the crap food, basically, excuse the language, more affordable, because that is what we've done in this country. We've subsidised the wrong foods and put that on people's plates, and it's all because of commercial interests and money at the end of the day.
You say we, but it's not we.
No, not us. Not us in this it's not we.
Hayley, what do you think the biggest challenge is that's blocking a more widespread transition to a plant-based diet?
It's the same, it's shifting the focus. So, as I spoke about medical education, we need to shift the focus to preventative medicine. We're all about treatments, about new innovations, and instead of looking back at lifestyle, and disempowering people. So, if we followed the pillars of lifestyle medicine, we'd have nowhere near the levels of chronic disease, and that would be it wouldn't be supported by pharmaceutical industries for other innovation, but again, all boiling down to money.
I was trying to have this conversation with my son, who's 9, and when you start breaking it down to a child, how our political system works, you see them looking at you like, you have allowed this to happen as adults? This is insanity. And you're explaining, how it works every 4 or 5 years, but no one wants to tackle a big issue because it takes long. And they're meant to trust us. They're meant to listen to what we do. Yeah, so I always find it very interesting because children can just cut through the crap and go, well, we should just do that then, shouldn't we? And we're like, yes, it's true. For me, one of our biggest challenges is obviously our current government and probably Alternative governments would probably be equally as problematic, as like Marisa says, while money is king, our food system in the UK won't change. There's much bolder governments around the world that have much tighter laws on, junk food regulation, sugar in products, energy drinks, chicken shops near schools, like really quite prescriptive approaches. And so it is possible. But in the UK, we're made to feel like that is somehow infringing on our basic human rights to kill ourselves quickly. And it's the way it's portrayed to us in the media, is that it would be really terrible suppression of our human,
they call it
human
nanny
entity.
state. They
The
say
nanny
over here,
state,
the nanny
yes.
state. It's such nonsense.
Yes, so we've had a great whinge. It's been wonderful to have you all, and let's have a big clap for all the panel participants. Thank you so much.